Pain in the neck? Not anymore when I show you this movement. Neck pain affects the vast majority of the population and can be from something as severe as an injury or as simple as a repetitive strain, whether it's from your desk at work, poor posture, or a bad sleeping position. Everyday activities like watching TV, reading in bed, or even looking down at your cell phone can cause your neck to be in pain. Most of this can be fixed by adjusting your movement patterns. In this video, I'm going to show you how to fix your nagging neck pain. But that's not all I want to give you today. Stick around to the end of the video so I can give you a special gift. I want to give you my Healthy Neck Guide. It's a PDF guide that I created to help you heal faster. But first, I'm going to show you an instant fix for neck pain. First, you need to know that this movement is intended for a broad audience, and you may require more specific attention. Also understand that if I was working with you one-on-one, I would be able to provide treatment and guidance on all of the facets of your pain. There is much more that goes into solving your problem that encompasses your whole body, and I encourage you to check out my other videos for a more comprehensive approach to solving your pain problems. You have spent too much time using the same muscle patterns and straining your neck, and that is what has led you to the pain you feel now. Use these movements I'm about to show you to retrain your body for the best way to move. This exercise is an exercise that almost everybody that comes to me for neck pain needs, and it's an often overlooked aspect to neck pain. Every time someone comes to me with neck pain, the first thing I notice is the position of their chest. The tendency for people with neck pain is their chest is very high. It's very close to their head. And this is caused because of the way that they're breathing. Their breathing is altered. It's not using the normal pattern of using the diaphragm to generate that breath and generate the intake of air into the lungs. And because this is occurring, you're having to use your secondary respiratory muscles to expand your chest to allow air to come into your lungs. And so the breath happens in your chest upward rather than in your belly and outward. So someone who breathes with their chest is constantly lifting their chest towards their head, which is compressing their neck all day with every breath they take. It looks a little something like this. Even just doing standing still, quiet breathing, these people will have a movement where I see their shoulders rising up and down as they breathe with every breath they take, which again creates that compressive force in their neck and uses the muscles in their neck to actually assist with their breathing. This causes too much strain, too much compression, too much wear and tear on the tissues, and eventually will lead to pain. So this exercise is specifically designed to use your breath as a way to pull your ribs and your chest away from your neck, to allow a decompression to occur and to get the muscles that are constantly overworking to shut off, to be inhibited, to quiet down, to relax, to give your neck a little bit of a break. And that's the sole intent of this exercise. This is not teaching you how to breathe. This is not about reestablishing a normal breathing pattern. This is simply about moving your chest away from your head to allow your neck to have space, to have some wiggle room, and to create some decompression. So with that said, we're gonna start this exercise by lying down on our back. So I'm gonna lie down on this table. You may choose to lie down on the floor. The harder the surface you choose, the better for this exercise. If you can't get to the floor, you can use your bed. If you don't want to use your bed because it's too soft, then try using a table. Maybe your couch is a little bit more stiff. Those are both perfectly fine places to do this exercise as well. If when I lie down on the table, I have neck pain, if you're someone that when they lie on their back, their head tends to fall very far backward and you have pain just from that position, then what I recommend you do is take a towel roll, a little bit of a lift, and place it in the very back of your head, not behind your neck. I'll show you in a second when I lie down where to position it. And you wanna make sure that you put you stack those towels or that lift as high as you need to so that you don't have any pain when you're lying down. So you should be pain-free. Even if you have to stack the pillows way up to get out pain, that's fine. That's not gonna be a problem. So I'm gonna lie down on my back, I'm gonna bend my knees up with my feet flat, and if I need that towel or I need that support, I'm gonna place it right behind my head. I'm not placing it down in my neck, and you can see that allows my head to go backwards. I wanna make sure it's placed right behind my head so my head stays in line, and my nose will feel slightly tipped down towards my chest. I don't need the towel, so I'm not gonna use it. So in this position, you can put your hands where they're relaxed. You can leave them on your chest if you want to, or you can put them down by your sides. I'm going to purse my lips and I'm gonna blow out in one steady blow. And I'm gonna blow all the way until my lungs are completely empty so that my chest moves down towards my pelvis. It looks like this. As you can see, my chest is moving away from my head and toward my pelvis. My stomach is not moving in, but slightly moving out. Watch again. For some people, the chest will move right away, and for others, the chest won't move until the very end of the motion or until your lungs are almost completely empty. And both of those are fine. The other thing to understand is anytime we are fiddling with how your body wants to breathe, it may set off a little bit of a panic that you're suffocating or that you won't be able to breathe when you do it. And that is totally normal. Don't keep pushing farther into that feeling. Just move towards that movement of bringing your chest down, and it's okay to let that nervousness come up. Your body will never suffocate itself. So just move slightly into it and then relax out of it. And then again, move slightly into it and then relax. Again, one steady blow out, emptying your lungs completely so your chest drops and moves away from your head. If you can, you want to try to hold the very bottom of the movement for a second or two. And you should plan on practicing this exercise for at least 5 minutes at a time. But ideally, you'll practice it until you understand the movement better, till you get better at performing the movement itself and that you've learned how to do it. Think of it like a dance move. You're not going to feel very coordinated with it in the very beginning, but as you practice, it'll get easier and easier for you to perform. And you want to be able to perform this exercise easily so that that translates into a change in your body.
Thanks so much for following along with me. You can repeat these movements every day for maximum results. Be sure you listen to your body and stop immediately if you experience pain. Pain means you are doing something wrong. As promised earlier, I have that special gift for you down in the description. That link below will take you to a page where you can put in your email for me to send you the free Healthy Neck Guide. If you have any questions, let me know in the comments below. Be sure to click the subscribe button so you can get even more pain relief and corrective exercises and tips. And remember to give this video a thumbs up and share it with a friend or family member who could use help with relieving pain in their neck. Until next time, take care of yourself.